Hello everyone! This is healthcare class. So today's topic is brain stroke. This is timetable. The first one is what is a brain stroke, and then we will learn the type of brain stroke and symptom of a brain stroke, and then how to deal with a brain stroke. The first one is that what is a brain stroke? So let's see that. A stroke is a brain dysfunction due to the loss of blood in the brain. When the blood supply is blocked or a blood vessel ruptures, it causes brain tissues to die. A stroke is a medical emergency, so treatment must be quickly. So what is a brain stroke? Let's see this picture. The first step is that this blood clot can form during arterial fibrillation. That means that the blood clot means that the blood mass. So the mass can form during the fibrillation. And then second step is that 저 다시 해도 돼요? 말이 꼬이는데. 잠깐만. 여기 페이지부터 다시 할게요. So let's see the picture. The first step is the blood clot. The blood clot can form during arterial fibrillation. Blood clot means the blood mass, so the mass can form the heart. And then second step is the trebling. So blood clot treble in the vessel. And then the final step is clot blocks an artery in the brain, causing a stroke. So let's see the types of brain stroke. There are two kinds of stroke. The first one is ischemic stroke, and then the other one is the hemorrhagic stroke. 85% of cases are ischemic stroke, and then 50% of cases are hemorrhagic stroke. So ischemic stroke happens when the blood clot stops the flow, and then hemorrhagic stroke happens when the blood vessel ruptures. So ischemic stroke happens when the blood mass broke the floor. Let's see the picture in the left. You can see that. And then hemorrhagic stroke happens when the weak vessel wall ruptures. In the right side picture, so you can see that. So let's run the symptom of brain stroke. What are the signs of stroke? The main symptoms of stroke are as follows. First is confusion, increasing trouble with speaking and understanding. And second is a headache with very painful things. And then third is vomiting. And the fourth thing is mumbleness of face, arm, or leg on the side of the body. And then you can see the trouble of seeing with dizziness. So there are symptoms of a brain stroke. The weakness, suddenly lose of strength or happen mumbleness in the face, arm, or leg, and trouble in speaking, suddenly difficulty speaking or understanding, and vision trouble, suddenly trouble with singing, and headache, very painful headache, and dizziness, suddenly lose of balance. So this is the most important things, how to deal with a brain stroke. Stroke happens fast and has a big effect on the body. It causes death if a person doesn't deal with the stroke properly. We have to find out symptom of stroke quickly and go to the hospital right away. The fast signal is a way to remember the sign of stroke. It can help to identify onset of the stroke more quickly. So what is the fast signal? Let's see that. So fast signal is this, like that. The F means the face. Does the face look uneven? And A means arm. Does one arm drift down? And S means speech. Does their speech sound strange? And T means time. If you notice any of the signs, the time to call 102. So how did you read the brain stroke? Let's see that. So we can remember fast signal, F-A-S-T. So the F means a face dropping. If a person tries to smile, does one side of a face drop like this or like this? And A means arm weakness. If a person tries to raise both arms, does one arm drift down like this? Please raise the arms like that, but someone can't drift. Someone can't raise one side of the arm, so like that. And S means speech difficulty. If the person tries to repeat a simple word, it is speech strange, so they can't speak well. And T means time to call 102. If anyone the signs are observed, call to the hospital 102. So this is a simple step stroke recognition. Ask the person to smile and stick out the tongue, or ask the person to make a complete sentence, or ask a person to raise both arms. This is a simple 3-step to how to deal with the brain stroke. Okay. So in the summary, stroke can cause death if the person doesn't deal with the stroke properly. We have to find out symptoms of stroke quickly and go to the hospital right away. The fast signal is a way to remember the sign of stroke. The fast means that the face dropping, arm weakness, speech difficulty, and time to call 102. We can save our family and neighbor to use these steps. Thank you for listening. This class is over, and next class we'll learn about Heimlich maneuver. Bye-bye.